Many people know the disease Alzheimer's or someone who has it. However, many do not know the extent of damage it does to an individual and their families. Personally, my grandmother was just diagnosed with Alzheimer's recently. I find this speech to be extremely valuable to teach not only me, but everyone about the importance of education concerning Alzheimer's. This is something that I was not very familiar with before I started doing research and looking up different things about symptoms and stuff about this disease. But while I was researching, I found that according to the ALZ.org in 2018, Alzheimer's disease is the most common form of dementia. At the onset of Alzheimer's, it may be hard to notice. I've heard different things about different people that have dealt with this that have not noticed that their loved one was going through this right away. The early stages are classified by difficulty learning. It may lead to more frustrating confusion, suspicion, mood changes, and many other different behavioral activities. However, Alzheimer's develops over time to the point of affecting their everyday lives. They become unable to remember loved ones or their environmental in these late stages of their disease. Alzheimer's is a relatively new disease that has been researched. This was something exciting or different that I learned while I was researching. Most of what we know has been revealed in the past 20 years. So just think about that. We can make so many different changes in treatments and everything. Although this research is all new, scientists are learning more about the causes and the possible treatments every day. Alzheimer's affects the family, the person dealing with the symptoms, obviously, and has different causes, diagnoses, and treatments that will be discussed in this speech.
Alzheimer's is a neurodegenerative disease that has an effect on the person who's being diagnosed with Alzheimer's, as well as the family. It has an effect on the degradation of the mind, and that causes strain on relationship, as well as difficulty living with Alzheimer's. According to an Alzheimer's Society UK journal, Understanding and Supporting a Person with Dementia. It begins with simple things that most people would never blink an eye about forgetting, like where they left their keys or drink or something like that, and it progresses. Eventually they get to the point of, there might be something wrong with me, and they go see the doctor. The doctor decides they might have Alzheimer's because, well, there's no definitive test for Alzheimer's until the person is deceased and they can view the brain. Eventually they begin forgetting important dates like birthdays, weddings, or anniversaries of their close family. Eventually they begin forgetting more important things like entire people. It starts with far off cousins that they don't really talk too much, and they might never notice that they forgot them. And then it moves to first and second cousins, and they start to notice that more and more. Then the grandkids, and then eventually their own kids. It is a terrible process to watch, and even worse to endure, I'm sure. And according to the Alzheimer's Society of Canada, impact on family and friends, there are difficulties that come along with a dementia diagnosis, such as Alzheimer's. First, the patient gets depression and anxiety usually, and that, along with their decreased cognitive function, can lead to irrational things that they might do that could gravely affect others or themselves. Eventually, the family starts to feel guilty because they get angry at them for forgetting something as simple as some other things, and they can't do all other things that they used to be able to do, and they're just not themselves, and they start to feel angry at themselves because they're getting angry at someone who has a disease that they cannot help. And eventually they become guilty if they get embarrassed in public by something the person would not normally do, but because of Alzheimer's it doesn't seem like any different to them. And according to a NIA journal, Alzheimer's Disease Fact Sheet, many things decline with your cognitive function, and that causes significant issues, such as you eventually begin to feel like you're losing your dignity to Alzheimer's, and it makes you become more reclusive, and you eventually begin to feel entirely dependent on your caregiver, which could possibly happen. whether that caregiver be a nursing home, hospital, or a family member who's decided to stop working to take care of you. And that leads into another problem, is financial issues that come along with an Alzheimer's diagnosis. Nursing homes cost a lot of money, and if you need to be admitted to one because you don't have a family member who can stop working just to support you, you are in a serious issue because you have no one to take care of you. Alzheimer's causes great stress for the family, the person living with it, and difficulties for them, and the degradation in the mind that leads to all of that.
Next, there are a bunch of different signs and symptoms that come with Alzheimer's disease. To better understand the signs and symptoms that come with Alzheimer's disease, it's easier to break it down into 3 separate stages. According to WebMD, Stage 1 is mild Alzheimer's, which usually lasts from 2 to 4 years long. The symptoms that come with this stage include having less drive to do things, less interest in doing things, and being more content with just sitting around, loss of recent memories and also language problems, small coordination problems, and finally, mood swings. Next is Stage 2, which is moderate Alzheimer's. According to WebMD, this is when memory loss gets worse and starts to cause problems in the daily life. This stage can last from 2 to 10 years long. Symptoms in Stage 2 include speech rambling, a hard time solving problems, confusion about certain things, getting upset easily, trouble sleeping, wandering, and also delusions. Finally, there is Stage 3, which is late Alzheimer's. According to WebMD, late Alzheimer's is the most severe stage. It typically lasts from 1 to 3 years long, and symptoms in this final stage include major confusion, not being able to express themselves, out of control bladder and bowels, extreme mood swings, and they can't move on their own very easily anymore. Alzheimer's is a very hard disease to have, and when breaking it down into 3 separate stages, the signs and symptoms can be easily seen. Overall, Alzheimer's is a very bad disease with some very bad symptoms.
Diagnosis, treatment, and cause and risk factors of Alzheimer's. Diagnosis. According to the February 13, 2018 issue of Medical News Today, there's no single test to detect Alzheimer's. Doctors look at the signs and the symptoms. They can look at your medical history, but they have to rule out other conditions before making a certain diagnosis, whether you have Alzheimer's or you're just forgetting. They can also test a person's reflexes and balances. Other assessments may include blood and urine tests, CT or MRI scans of the brain, and screening for depression. Sometimes Alzheimer's is an inherited disease, so they do genetic testing. And after this initial testing, they move on to the cognitive and memory tests. Cognitive assessments deal with the gradual memory loss and progressive cognitive impairment. They may ask questions like, what is your age? What is the year? What is your date of birth? Genetic testing is used in specific cases, and a gene known as APOE-E4 is associated with a higher chance of people over the age of 55 of acquiring Alzheimer's. Using this test early can indicate the likelihood of developing Alzheimer's, but the test is controversial and the results are not entirely reliable. But there sort of is a treatment, but the death of brain cells cannot be reversed and Alzheimer's cannot be treated yet. There are therapeutic treatments that make it easier for people to live, though. Management of conditions occurring during Alzheimer's helps, and activities of daycare programs, support groups and services, and drug therapy are big deals with helping with Alzheimer's. These drugs help reduce the symptoms and help improve the quality of life. Aricept, Exelon, and Cognex are the 3 major types of drugs that help with Alzheimer's. Cause and risk factors. Alzheimer's is caused by brain cell death. It is a neurodegenerative disease. It means that there is progressive brain cell death that happens over time. A person's tissue has fewer nerve cells and makes less connections than normal people do. Autopsies have shown that deposits known as plaques and tangles build up on these tissue. Plaques are made of beta amyloid. The tangles occur within the nerve cells and are made of a protein named tau. Risk factors for developing Alzheimer's include aging, family history, genes, and sometimes it's just not enough exercise.
Alzheimer's affects the family, the person dealing with the symptoms, and also has different causes, diagnosis, and treatments. Alzheimer's can have a very negative effect on the family of the person with Alzheimer's. This disease makes people forget things that they do every day. The longer they have it, the more they might forget over time, like even forgetting their own family members. Having Alzheimer's can be really difficult to live with. This can cause a lot of stress and tension between the family. There's not a specific test to tell if you have Alzheimer's yet or not, but doctors can ask questions to be able to determine if they possibly might have it if they are starting to forget a lot of things. Alzheimer's doesn't have its own treatment yet, but there are different ways to help people get through their everyday life a little bit easier.